Hello. I am here. I was coming from the other class. I want to go ahead and introduce our guest speakers today. So I'm Melanie Cunningham. I'm with NAMI, Kentucky, and glad to see everybody here. So we have two wonderful ladies on here. They are with Janssen & Johnson, and we're excited to work with them. We've been working with Angela for about 2 years here in NAMI, Kentucky. And this is our first time with Debbie, but we're excited to work with her too. And so they are going to be talking to us about partners in care. And Angela is a CSW and Debbie is a LCSW. And they are part of Janssen's Neuroscience Medical Affairs team, and they are the liaisons. So without further ado, we will start with Angela and Debbie and learn about partners in care.
Good afternoon. I'm Angela, Community Medical Liaison representing Janssen Pharmaceutical. We first want to say thank you, NAMI, for allowing us to be a part of this amazing conference. As CMLs, we have the opportunity to bring resources to consumers living with severe mental illnesses. We have a curriculum, 5 facing presentations for consumers to get involved in their treatment. We want them to know that they matter. Just because you have a diagnosis does not mean that's everything. That is just one entity of your personality. Choices and Recovery is a curriculum intended to engage, encourage, and motivate consumers to know their medical history. Know your diagnosis. Know what medicines you take and why you take them and the side effects. Know what your treatment options are, because there are always options. And that's what we do. We encourage you to live your best life. I am in Indianapolis, Indiana. I cover Indianapolis, I cover Michigan and Illinois. We have about 10 community medical liaisons, and we are doing our best to make a difference in this world. I would like to introduce my colleague, Debbie, and she's going to tell you a little bit about her and what she does in her state. Take it away, Debbie.
Thanks, Angela. Hi, I'm Debbie Speicher. I'm based out of Ohio, and I'm also a community medical liaison and a therapist by profession. And today we're really excited to bring this Partners in Care presentation to you and lead you through a journey of how to make the most of caregiver relationships. Whether you're a consumer or a family member, friend, that's why we're here. And we're going to end up doing a role play within the presentation. So we're really excited to talk with you. And at the end of the presentation, we'll take questions.
Sounds good, Debbie. So why are we here? We are here, as Debbie said, for education purposes. Even though Debbie and I are both therapists, when we wear the hats as community medical liaisons, we are educators. We're here to partner with your treatment team. So it sort of works like this. We have collision partners with Janssen, sales rep, medical science liaison, district managers. They have the relationship with the treatment team. They realize that sometimes an education piece is sometimes missing, and consumers need to know what they're dealing with. We are invited into that particular setting. We'll meet the person that makes those decisions, the therapist, the social worker, the director, whomever can make the decisions. They allow us to come in. We set together with groups and we provide this curriculum, Choices and Recovery. It's about empowerment. It's about education. It's about making sure they know that they are supported. Janssen gets it. They believe in education. This is a free, non-branded opportunity that we bring to you at no charge. Can you believe that, Debbie? No charge.
I know, it's wonderful.
You can't put a price on that, can you? But it's awesome. Consumers understand that they are at the table and they are leading the way. They need to tell us what it is that they're going through so we can put together best practices and information to make them feel good about themselves. We want to make sure that you understand we're not there for therapeutic reasons. We are there to provide education. So we do not provide any personal medical advice, not at that time. Today's program will discuss the role of a caregiving relationship when it comes to mental health capacity. We all have relationships that we deal with, but we've got to be considerate of our consumers and understand that they're adults now. So sometimes as parents and caregivers, we're used to being in control. But at this time, the consumer is in control. We have to really respect boundaries and do what it is that they feel is best for them. We want to explore ways that loved ones can support each other. And it looks different to different people because we're all individual and we're all different, but we're going to work it out together. We want to empower you with strategies, good communication skills, healthy partnerships. Sometimes, Debbie, if I say something that is wonderful, but how I say it is negative, it defeats the purpose.
Absolutely.
Right? And sometimes if a person is having a bad day and I say something that can hurt their feelings, I may be sorry, but guess what? The pain is still there. So we want to practice on how we need to balance that and think before we speak. It's not easy, but Debbie, it can be done. So Debbie, talk about defining the recovery journey.
So let's go ahead and start with talking about it. And so recovery, obviously, it's an ongoing process, and it's something that many individuals work on throughout their life. Each person's recovery experience is unique, and recovery is more than just managing symptoms. It's more than just taking a pill, right? It's finding the meaning in your life and working towards goals. And I think of goals as those to-dos, things that you maybe you're trying to do every day. For instance, like getting up in the morning, getting dressed, taking a shower. So those are the kinds of goals that you can have, and you can find your meaning in life by doing those things. Also, working with your treatment team to identify a personalized plan that works for you. That's really important. And the consumer is at the hub of this recovery journey, and there's all the support around, but the consumer has to invite those folks in to support them. Go ahead, Angela.
That is so awesome. Deb, you're right. I want everyone to understand that you're all an individual. You're different. You may have the same diagnosis as someone else, but you can be on a different medication. You can have different symptoms, and that's okay. We want you to understand that you're an individual. And regardless of the situation, as you can see, Deb, this nice heart, you are loved, okay? It starts by loving yourself. You need to understand what the diagnosis is, what it can demonstrate, and be able to articulate that to your family and friends when they ask questions. We want you to be really strong at understanding the mental illness, because through that, you're going to develop those relationships with your loved ones, okay? We want those relationships to be positive. We want them to be productive, okay? And we want to listen. We've got to learn to listen to each other. We've got to learn to be trusting toward each other, and make sure you understand this journey is not easy. Nothing is easy, especially when you're dealing with a mental illness. But when you have family members and caregivers and community that cares, it makes a big, huge positive difference.
So what is this support network, and who's in charge of it, Angela?
I think the whole community is, right?
takes everyone, doesn't it?
It does. The village.
The village, that's right. So your support network, right? Who are those folks? And that's what the consumer needs to decide. Who do I want to support me? What is that going to look like? What role are they going to play? And how involved are they going to be? There's many different people that are around us and around consumers. There's doctors, there's nurses, there's case managers, there's therapists, there's family, there's friends. So there's potential to be quite a few people. And so it's really important for the consumer to talk with all different people to see how they want them involved in their treatment and in their recovery.
So let's talk about support and how it looks and how sometimes we have to have the discussion of a backup plan. Sometimes we'll put things in writing, Debbie, and we'll say we're going to do this, but when things happen, it changes. Let's talk about making sure that when you are at your best, when those symptoms are normal, you want to be able to talk to your loved ones about how things look when it may be messy, when your symptoms may be really prevalent. Do you want your mom to call your doctor, your nurse, your best friend, your minister? Talk about that while you are at a place that you are both calm and cool and everything is good. Because when it starts, when you're in the midst of those crises, it's not going to be so pretty. So we want to be proactive and be able to talk about these things and address them before things get out of control. How our supporters would like to be utilized are being with us, okay? They're asking what's going on. They don't know what they don't know. And so if you are just having symptoms of hallucination, or you just are dissociated, that's okay. Let them know that this is how I look. This is how I'm acting. This is how I'm feeling. So they'll be in the know. They want to be able to do things that's going to support you. So when you are healthy, that you know they're by your side. For example, if you go on appointments where we know you have plenty of appointments, can they come with you? Can they hold your hand? Can they be able to hear what the doctor is saying so they can support you when you're having those hard times? I know that oftentimes consumers will say that they're intimidated when they meet with the doctor. The words are very high level. I have no idea what they mean. Maybe that support system can help you by writing things down. When you're at home, you may have things you want to talk about, but when you're there, you may forget. We're human, we forget often. Maybe that support person can write stuff down and say, hey, don't forget to ask about that. Ask about that question. They want to just be there to help you. And sometimes we have a hard time saying it because it may come across that we're being nosy, but we just care, okay? Sometimes consumers would say that the medications, some of the side effects make them crave sweets or salty foods, which kind of can be gain weight. We don't want you to stop your medicine because of those side effects. We want you to work with your consumers, work with your loved ones, and find out what can we do together to deal with these issues. Exercise, move more, and eat less in proportions, right? There are so many good foods out there that you can just Google and a good recipe and be able to eat healthy and maybe not gain as much weight. Whatever works for you, you tell your loved ones so you guys can do it together. Maybe go with you on your checkups. It's important to be healthy from the inside and out, making sure you go to your dentist appointment, your annual doctor's appointment, and your quarterly appointment with the psychiatrist. You want to be able to do things together. I would imagine, Deb, that in life, it's hard anyway. And how hard it is to do this by yourself. You have family members, the community that want to help you. Please allow them to be a part of your life. You may want to go shopping together, go do finances, do things together that you can get help with. So we want you to understand that it's hard, we get that, but it doesn't have to be something that you do alone. So please consider allowing those loved ones to be a part of the solution so they can be a part of your life forever.
So how else can supporters help you? Well, they can help you learn about your condition. I know sometimes we do research as consumers, and sometimes our family members don't know everything about our condition. So taking them to a doctor's appointment, giving them the information that you may have gotten from the doctor, and or having them come to the doctor's appointment so they can learn more about your condition. Because the more each of you, the consumer and your supporter, your family member, friend, know about your condition, the more they can help. Also, reminding you to take medication. Everyone has a different way to be reminded of how to take medication, right, Angela?
Absolutely.
Everyone wants to be reminded differently. And so as a consumer and or as a supporter of a consumer, this is something you really want to talk about because it can be a source of stress, because some folks think they need to remind you every day, and some people only need to be reminded maybe once a week or at bedtime. So it's very important that everyone's collaborating and talking so that no one gets frustrated, no one gets stressed, but yet we can still help. notice changes that might signal a relapse. So one of the things that supporters can help do is when they know those warning signs that maybe you might be starting to have more symptoms, they can help for you to notice that and help for you to maybe talk to the doctor about changing medication or talking to the therapist about getting a new tool to help you with coping. So they can start to notice the little things. Some of those sometimes are isolating, sleeping a lot, maybe not showering, but each consumer has a way of noticing things before a relapse might happen. So those early warning signs. And the supporter can also be there through a setback. Sometimes, we fall off of our recovery journey. I like to think of our journey as rocks that going across the river, and we step on those rocks, and maybe somebody is, in front of us, and sometimes we slip off those rocks, and Angela might grab my hand and pull me back up so that I can get across the river. That's what our supporters are there also to do, is to pull us back on the rock and keep us going so that we can continue to, enjoy our life and try to achieve our goals. And they're also there to help you explore treatments and help with treatment decisions. Sometimes there's maybe a new medication that may come out or a new therapy, and having folks around you that can help the consumer really gives a different perspective so that they can make the right choice for them. But again, in all of these cases, it is the consumer who is enabling how much support they want. But as a family member or supporter or a loved one, you can ask about some of these topics and start a conversation to find out how your loved one wants to be supported. So thank you, Angela. Back to you.
Awesome. And Debbie, I'm just looking at this mom with the heart on her shirt, okay? Regardless of how old you are, your parents, your people still love you, okay? It's so hard for us to let go as parents, and we already know the mistakes that we made, and sometimes we can be overbearing because we don't want you guys to make the same mistakes. So give your loved ones some benefit of the doubt. And sometimes you may think it's intruding, lack of boundaries. It's sometimes all out of love. They just want the best for you. When you think about the supportive treatment options, know that therapy plays a huge role in the recovery process. Being able to talk to a professional about what you're going through, about your fears, about your experiences is going to help you feel better. When you hugger things inside, you get sick, you can't sleep, you can't eat. We want you to be able to talk about it in a safe environment. Society say that we feel better when we are employed, we're doing something for ourselves, for others. So if you can work, why not do it, right? If you can do volunteer work, do what you need to do to make you feel good about yourself. They said the best job, Deb, is the job that you would do for free. So wouldn't it be wonderful we can all find that wonderful career? But whatever you find, just find some joy in it and make sure you're doing it for yourself and not for others. Being in a housing environment that is conducive to learning, that is safe, that brings you joy is very important. As I said earlier, living with a mental disorder is already stressful. So to be in a home that you find support is something that is very, very needed. Peer support. Working with people that care about you, that you care about, that you have some of the same common goals, make you feel good about the situation. So make sure that you have that relationship with your peers, that you are honest with each other and you keep each other together. Support groups. When I think of support groups, I think of NAMI. That's like one of the #1 groups I can think of. NAMI does so many amazing things. I'm thinking about some of the groups they do. The NAMI support groups include NAMI Connections. You have NAMI family support groups. You have NAMI peer-to-peer groups, NAMI peer-led groups, and even caregiver groups and online discussion groups. These are groups that are free, and they're for NAMI families and consumers to give you some insight to let you know you're not alone. Deb, I was just at Central State University, my university that I graduated from, and I met some amazing, lovely students that have a NAMI group there on Central State University campus. And I'm just so proud of these young folks trying to figure this out and just trying to find some hope and solutions for each other. So kudos for Central State University. Other support groups are, I understand, church groups, groups that may be NA, AA, and even support dogs. These are opportunities that provide support for folks. So whatever works for you, you make sure you implement that. Debbie, can you think of any other groups that we may not have listed?
Well, I always think of, groups where it's around a hobby or an activity that you care about. So it can be something like that. That always can lift your spirits, which is good for your mental health.
I love it. Hobbies are great. So talk about the medication piece, Debbie.
So there's a lot of options, right, within our recovery journey. And one of them is medication. There's something called short-acting medication. And that medication comes in the form of taking it in a pill or something that dissolves under your tongue, or you can take something where you can drink it. The short-acting injectable is something that I want to talk about because it's important. It normally happens if you're in crisis and you're in the hospital. Not everyone receives a short-acting injectable, but I want you to know that it's very different from another medication that we're going to start talking about, which is a long-acting injectable medication. And the long-acting injectable is, I want you to focus on long-acting because mostly people that want to be free of taking an oral medication every day, one that they already are doing well on, can move normally to a long-acting, which may last a month, 3 months, some 6 months. Obviously, that's a decision that you make with your doctor, but I want you to know that it is available or could be available to you. But it's something that gives us a little more independence. At least that's what my consumers tell me, that it gives them that independence, and they know that if there is a relapse, they know that their medication's on board, so that the doctor or their healthcare provider can take a look at what may be causing the relapse when they know that it wouldn't be the medication, because medication is already on board. And it's one way to make sure that you don't have to remind yourself of taking medication every day. So it gives you a lot of freedom.
I love that, Debbie. I just did a presentation today at a group home, and one of the gentlemen said that he had been in the hospital about 5 times. He'd been in prison about 3 times. And I said, what was the disconnect? He said, I just stopped taking my medication. And I said, so what did it when you finally said, I'm tired, I'm gonna really do the right thing? And he said, unfortunately, he lost his sister due to overdose. And he said it was a wake-up call. Unfortunately, it was such a hard wake-up call, but he's been clean. He's been in this group home for about a year now. And he said it has changed his whole life. And he's on a long-acting. He said that he hates taking a pill. He forgets it, or he would double dose, which is not good. So at least, you know, with the long-acting, it's an option. We talked earlier about choices in recovery is an option. We're going to show you different options that you can choose based on your personality. So he chose this option, and he's finding life is much better because of that. When you do meet that medical provider for the very first time, you're going to be honest, or try to be honest, and tell them your medical history. Tell them what has happened in the past, what medicine you were on, what worked, what didn't work. They want to know your family history, who have mental illnesses, just so they can get all these different information to give you the correct diagnosis. And with that diagnosis come a discussion of medication. Now, medication is not everything, but it's a large part of the recovery process. Treatment team, family members being engaged, that makes up a lot too, but medication is a discussion you gotta really have. And you decide, you know, once you get the information, if this is for me. If it's not, then you have a discussion. But we highly recommend you do not discontinue medication cold turkey. That is not good for the brain. that is not good for you, and it's definitely not good for your recovery process. So we want to learn from the mistakes of others and make sure you guys have all the information you need to feel equipped. They're going to talk about the benefits and the risk, but at the end of the day, Debbie, the client, the consumer, the patient has to say, this is what I want to do. We can tell you all day long that we want you to do this based on research and data and best practices. But if you decide you're not going to do it, then you're not going to do it. And until you make up your mind that this is the path you want to go, that recovery is for you, then we'll be there with you to walk you right through. And that's what love is all about.
And love is working together, isn't it, Angela?
Yes, it is.
To piggyback on that, and we've talked a lot about the way that you can have a caregiving relationship, a lot of different ways to do that. And one big piece of that, of your recovery journey and partnering, is having a shared goal. Having a shared goal really helps to get everybody on the same page and helps to move the consumer forward to what they're trying to accomplish. And so sometimes what happens is we'll hold inside what we want to happen, what we want to do, and we don't tell those that are trying to support us. When we let people in on what we're trying to accomplish, it makes everything in our life a lot easier to do. And once you share those goals, those to-dos that you're trying to achieve, you can make a plan together. And in that plan, you can discuss, how do you want your loved ones to help you? How do you want your case manager to help you, your therapist, your doctor, your healthcare provider? So starting out and thinking about, what goal do I want to achieve, and then sharing that, that's going to really allow everyone in the support system to help that consumer succeed. And again, it's up to the consumer to communicate how much and who they want involved in their plan. So I hope that you'll start really looking at, how can we work together? And that starts with communicating and communicating your goals.
I love that, Debbie. And you mentioned so many people that's a part of that recovery plan. You said the doctor, the nurse, the social worker. There is a whole network. So we want consumers to know, once again, you are not alone. You have the whole team. It's up to you to take advantage of that opportunity. Communication and listening and being respectful is the key to a lot of success here. It takes two. We can't do this by ourselves, okay? We need you guys to work with us. As the consumer, you are in charge. We are following your lead. We're going to support you, but we want you to communicate. We can't read your mind. We don't know what we don't know. And so it's up to you to communicate with your healthcare provider what your needs are, what your experience are, and where you want to be as far as your goals. It's a two-way communication. When they're speaking, we're listening, we're comprehending, and you may want to repeat that. When you're speaking, vice versa. You have an equal opportunity and a partnership with your treatment team, but it starts by you being engaged. Try to be clear and be consistent with what you're saying so that we can be on the same page when you're doing your treatment team, your treatment goals. All those things are kind of lined out. Understand each other's expectations, and you don't have to always agree, but you want to be respectful in how you communicate. Share your thoughts. Share what you've been through and share what works for you so that you can say, I can't do this. I've done it before. It didn't work. That's a good way to communicate. And let's listen. Let's listen, let's learn, and let's just try to grow together. So this is the part that Deb talked about at the beginning. We're going to do a role play, and we want to show our consumers and our caregivers that this can work. A lot of times when a consumer first gets the information about they have a diagnosis, it's devastating. I mean, it is scary to think that, okay, I felt that things were going well and all of a sudden my life is changing. I can't imagine the fear a person go through, but I'm so grateful knowing that we have caregivers that want to be a part of the recovery process. So we want you guys to kind of see a practice drill. Deb we're both in college, and we've been friends for years since we were in elementary school. So I'm seeing some differences in my friend. I don't know how to really connect with her. I don't know if I'm stepping over boundaries, if she is angry with me because she's not communicating. And so we're going to do this, explore this here, listening and learning exercise. And so she's going to say her thoughts and I'll say mine. So the treatment issue is what I would like treatment to address most is.
Well, I just got diagnosed with a mental health issue, and I'm really, I really don't want to talk about it. I don't want to, I'll deal with this on my own. I don't want people making fun of me, and I don't want to be ostracized and left out of everything. I'll just do this on my own, and it's, I don't really need you, Angela, right now. I'm fine on my own.
Wow. And let me take a moment to process what you said. So you're my friend, and we've been together since elementary school. And you're telling me now that you have something that is affecting your life, and I can't be a part of that. I'm a friend, thick and thin. I'm a friend, good and bad. I'm with you, and I want to help you through this process. You're not alone, and I refuse to let you keep me out of this because I care about you and I love you, and I want to help you. Please tell me how I can help you, please.
Well, thank you for being accepting of me. And I think maybe we can talk a little bit more about it, and maybe you can listen to kind of what I've been going through. I'd really like to talk because I haven't told anyone because I'm so afraid. So thank you for talking to me and not leaving me.
I respect that, friend, and I'm here for you. When you're ready to talk, I'm ready to listen. But thank you for telling me what you told me. It explains a lot. Thank you. So guys, in a nutshell, that's hard. It is so hard for a person to open up and say, my life is going to be different. I thought it was going to be this, but guess what? It's not. And that's a life that you're not going to live by yourself, because caregivers and your friends and your loved one will not leave you alone. I wouldn't leave you alone. And so I can say from personal experience that Debbie and I both have people we love dearly that have gone through this. And we take our roles as community medical liaisons very serious. It's a job, but it's a lifestyle. When we're working with consumers, with families, we take it serious. If it was us, I would want the same respect, and we're going to give you the same respect. So Deb, thank you for sharing that. I hope that this real life situation, because it's real somewhere, can help you understand that it has to start with the conversation. It has to start.
So one of the pieces is, as we bring people into our lives to support us, consumers and family members need to know that our health information is private, and there are laws, and they're under HIPAA, that keep our information about our treatment very private, and it cannot be accessed by anyone except for the consumer. So when the consumer is feeling good and stable, it's really important to sign a consent with your healthcare provider, so that if you are in crisis and you want someone to come and help you or be a supporter, that someone who's in your family or friend circle, that you're given your consent so that they can be there for you, especially during a crisis, or if you just want somebody to be able to look over your treatment. This is why it's really important. But again, your information is highly confidential, and so it can only be released when we sign a consent, releasing it and allowing someone else to see it. Anything else to add on that, Angela?
I think that's awesome. I want consumers to know that at one point, if you change your mind, that you decide that you want to retract that, I don't want my family involved, that is fine. You have the right. You're an adult. We respect that. So guys, remember this. Together, we can all do great things. This is hard, being able to live a life that you had no idea you were going to live. But I feel good knowing that you're not living it alone. We're here with you. Your loved ones want to be involved in ways that make you comfortable. We don't always know how to say it, but we love you and we want to be there for you. They want things to be as clear as possible. We know things change, but if you can be clear and let them in to the recovery process. They want to see you through the ups and the downs. They want you to be open and honest with them. And we want you guys to celebrate the success. Celebrate the things that you have accomplished. When we're doing our groups, Debbie, and we hear consumers talk about what they've been through, sometimes they are blown away with the stuff they've accomplished. That's why I think Choices in Recovery is such a great avenue to talk about things so you can hear, man, I've been through that and I'm still surviving. Yes, you are. We have an amazing website of resources, Choices in Recovery. It's www.choicesinrecovery.com. Please look at the website, and every presentation that we do, all the worksheets is there. And for the caregivers, there is a section just for you. It talks about taking care of yourself. You know, as caregivers, sometimes we are so busy taking care of others that we forget to take care of ourselves. So take care of yourself, get your rest, do your exercise, do your yoga, do the meditation, all those things that's going to give you some support, do that. I wanted to also name a couple of other mental health organizations that are really active. One's called Active Minds, Bring Change to Mind. International Center for Clubhouses. They do a lot of great things for consumers. Mental Health of America, National Alliance of Mental Illness, that's NAMI. NAMI is number one. I think I'm a little pro NAMI, Debbie, what you think? But I am, because it was my collision partner, Lisa Easter, who introduced me to Melody, and she's the president for the Lexington NAMI, and our relationship has been just positive, progressive. She really knows the meaning of collaboration and partnership. So thank you, NAMI, for allowing us to be a part of this amazing conference. We wish you all the very best, and we thank you guys for your time. We're going to have you guys to ask questions in the chat box, maybe give us some resources so we can pay it forward. On that note, Deb, you like to end the conference for us?
Let's celebrate. We made it through, and we appreciate your attention today, and we wish you luck on your recovery journey.
Are there any questions or comments? That was lovely. And at the end, Angela, I want to ask you, because we know we do our class, so we might start that in January, but we got a partner on that.
Absolutely. So, anything you need, I'm there for you.
Yeah, and the workbooks, I love those workbooks. Like, it's, if you come to the class, whether you're a provider or a parent of, yeah, those books alone are worth coming. So if we have this class in January, get on our constant contact list, we start blasting it out and come to the class, and then Angela sends me the books and the envelopes. I start heading to the post office to mail them off. But yeah, it's definitely worth taking the class.
And I love the fact that when we get together, Mel, the consumers are talking about they've been using the workbooks, and they share with their therapist, individual, as far as group. So they go a long ways. They want to tell us what they've gone through. So you know they're getting a lot of use out the workbook. So it's a good deal.
Yeah. And they come back too. Like if they took the class 2 years ago, they'll come back.
Absolutely.
Yeah. And we do it all virtual right now, online, just because our COVID issues and stuff. Right.
So we have 5 sessions, guys, and we were doing like every other Wednesday. And I'm telling you, the conversation was just so strong, and the experiences were so great. They just kept bringing other folks, and they were teaching us a lot as well. But I'm glad that they got a lot. It was so good, Mel, that we did another round like a couple of months later. So it's good for all of us.
Yeah. We got wonderful presentation.
I checked the chat, guys. I didn't see any questions. I saw just comments. If I'm missing anything, please let me know.
Look, Jayla. Somebody named Jayla Marvin does. Let me flip and see if I can see her. Jayla, you want to ask your
I-
question?
From Michael.
Oh,
Okay,
I
there you
can
go.
ask a question. So my question is, how can I be the best support system to my members that is on campus? Because Miss Angela Shore had mentioned that we do have a NAMI on campus, and I am the president of, but I'm just trying to figure out how can I be the best support system to my members on campus.
Melody, you take that because Jalen, sweetheart, you are so adorable. You and Henry, he's the VP, and I went there for career day, and they are trying their best to make it work. They need training, they need resources. So please help me help my people.
Henry, I'm sorry, Henry is not the VP.
Oh, what is Henry?
Henry, he's just a member.
So what are you the president?
Yes, I'm the president. My VP name is Camera Hall.
Okay, thank you for the correction.
Oh, you're welcome.
Okay, I just put my email in the chat. So if you email me, we can chit chat about like trainings that you all can take and getting materials and supplies so you all can set up little booths and have information and just like different things you all can do, like awareness. Like we had a skate-a-thon back in July here in Lexington for mental health awareness and tardive dyskinesia. So there's fun activities you can do at the university or some sort of bowl-a-thon or just fun things to bring awareness and so that people seek treatment and are aware when they're decompensating. So we can chit chat about that. And let me put my work cell in here now. After this conference, I'm gonna take a couple of days off. So next week, I'll be back to work Friday.
You need a break. You need a break.
Yeah.
You do.
But yes, you can call me or text message me and I will chit chat with you on that NAMI on campus and what that all entails.
Awesome.
You know,
I also want to bring the choices and recovery to them. So we'll do some stuff together, and I'll bring the food and the comfort and the resources. So we're going to do this together. And of course, Debbie, she's going to be involved because she's now going to have Kentucky.
And what campus is she at?
Central State University of Ohio, Wilberforce.
Oh, okay, Ohio. All right.
My friend Kathy has something she wants to say, I think.
Oh yeah, thank you. I know Angela I'm from Centerstone of Indiana in Columbus, and she was coming to us with the presentations, but you know, through COVID, clients have lost a lot and we're trying to get them back. They're not where they were at before COVID. So we're going to have to start this process over again with Angela, because it seems like they've lost it. We do have some clients that have started on the 3-month injectable.
Oh, acting good.
Yeah, but I noticed that, you know, I think that's our problem. You know, COVID hit, and then we were in red until about 2 weeks ago. Centerstone was, you know, so it's like, you know, they don't know if they're coming or going sometimes. So that information needs to be refreshed. So I'm going to have to get with Angela, but she's very good at, you know, working with our clients. And also, and then I'll be quiet, we've had clients to die. I've been there 16 years, never had a client to die. And since COVID, we've probably had 10.
Ooh.
We had one last week. And we think he never got over COVID. You know, so that doesn't help either.
Are they getting the shots and the boosters? I know some people have, like, they'll say the voices and just get paranoid about it. Are they not?
I think it's 50-50, you know, that's a confidential thing, you know, they can, so, you know, some of them tell us they don't, and then, you know, some of them will tell us that they do have it, you know, that they did get their injection, and we encourage them and help them set it up and even give them transportation.
Okay.
So I think our clients have forgot about the support that they really do have now, because they were kind of like, we were shut down, we would talk to them by phone or, you know, they'd be on their porch. I'd be in my car. Actually, I didn't even see any, but some of the other workers did, so we're just getting back in the mix of things now, but we're going to start our program over with Angela because I think our clients do need that.
Kathy, COVID just hurt so many of us in so many ways, the young folks, the teenagers, elderly, even us in our field. So you're right, we got to get back together and we got to take care of ourselves to you and your team. We're going to take care of ourselves first and then we'll take care of the consumers. But I'm definitely ready to come back there.
Okay.
Oh, Jayla wanted to say something.
Okay.
Hi, so I was just trying to figure out, could we I know that it's not that many counselors on our campus, but I feel like we need more counselors on our campus to support the whole campus as a whole, because just one or two is probably not doing it.
Mm-hmm.
But the only thing I can say is that we do need training in a lot of areas on Central State campus, in that area, like in counseling services. But I just feel like we do need a lot more resources, and a lot more counselors like male and female, because we want the students to pick and choose who they want to talk to, based on their preference, and just not just strictly female, And so I just feel like I want to be the voice for Central State, far as on the mental health side, just to help bring in a lot more resources. And also we might do need a certificate, to hold for CPR lessons and stuff, just in case if we needed to do that. But it's we need to have that through Central State so they know that we hold that, and we don't want them to think that we are not allowed to perform CPR on the students, and that can lead us into a lawsuit with somebody. I'm just trying to keep it safe for students that wants to perform that type of thing on students. So
I like how you think, and you're trying to be proactive and you want to be preventable. So we probably have to meet with the administrators to see if that's allowed. Melody, do they get CPA training when you guys do NAMI training?
CPR. They do. We have some first aid NAMI, mental health and stuff like that. So I know they have to be 18 and older, but we can check into that. And then I'm also going to connect you with the KSU. I know you weren't on here earlier, but we J-Love, but we have a new KSU NAMI on campus, and their director is also the director of the counseling center. So they actually have a counseling center at KSU. So they're doing a whole lot of stuff, and they have a NAMI on campus there too. So I'll get you connected.
That's great. Any more questions, guys? Any comments?
I have a comment that I just wanted to say, Melanie, what a wonderful job you all have done, and what a wonderful participation that we have received here, and people coming on, and it really, I'm so glad that we're all here, and seeing so many people, I guess, just really moves me that there's so many of us, working together, and so I just want to say thank you to everyone who participated today.
Totally agree. And it's a Saturday, guys. You could be doing so many other things, but instead you're here with us learning, and we thank you. We don't take it for granted. So we really appreciate you guys.
And Angela, the Partners in Care, that's one of the 5 classes, right?
Yes, that's one of the 5.
Yeah, that's one of the 5. So yeah, if you attend the class, and I'll be getting with Angela, we'll probably try to hit that in January, but you'll get that manual. It's really nice. All the manuals are nice and very informative, and just a good resource base to keep.
Yes.
So make sure,
the website, guys. The
Yeah.
website, www.choicesandrecovery.com. You go there, you'll see all the workbooks we do. Only thing you won't see is the PowerPoint presentation. That's because you need me and Debbie to do that. But everything else, you download it. But we love doing these presentations. I love the fact that when I go back to a site, the consumers are waiting for us because they want more information. And they want to share with us what they've learned and how the relationship has advanced with their healthcare provider. They were scared to talk at first, but now they know about medicine. They got things written down. They ask the right question. They feel empowered. And that's what Choices in Recovery is all about, make you feel good about yourself.
Oh, I do have I don't know if it's a question, but in Columbus, Indiana, we don't have that NAMI. It's like, it's in for the clients. It's like 25 miles away. So how do we get like a NAMI? Because I think the clients would like to do that because they used to do it in Columbus and they would have clients participate.
Yeah, you can email me at that, and I'll put it in the chat again. And I can definitely get you the information on how to get one started there closer so that it's not so far.
Okay.
Let's see it, NAMIKY.org. Yeah, and it's not that difficult to start a NAMI affiliate, but I can definitely get you the information. That way you can have one local and not, have to travel. So I'll be working on emails this weekend. Like I said, then that Monday through Thursday, I'm gonna take a break and I'll be back to work on Friday. But if you email me this weekend, I'll definitely want to try to catch some emails before Monday through Friday. Monday through Thursday.
I'm proud of you. You take care of yourself. Self-care.
Yeah,
very good. You need to do that.
Yeah. We are growing in leaps and bounds. And Angela knows, like, I'm always working around the clock and at night and craziness. Yeah. So yeah, we have to take care of ourselves, especially as caretakers. Yeah. Does anybody else have any questions or comments?
Share any stories? Going once, going twice.
Hello, hi. I have a question. Can you all hear me?
Yes.
Yes.
Okay. Hello everyone. I'm Daniela Dorset. I'm a business marketing major at Central State University. And I currently serve as Miss Central State University. So I actually worked with a team for the past 3 weeks creating an app for a competition. And the app that we created is a mental health awareness app provided by an employer to the employees, where they're able to receive therapy sessions remotely while on the job, right? So it's a prototype, it hasn't been released yet. So what I want to ask is, have you all ever used an app or any type of software provided by your employer to aid in mental health solutions? I guess that would be the question.
I believe NAMI has some apps. Now we don't at NAMI Kentucky, but I believe NAMI National has created some apps, if I'm not mistaken, to help with mental health.
Okay,
but that's great. That's great that y'all have done that.
Thank
Awesome.
you. So NAMI has apps, but you've never had your employer supply you with those benefits, correct?
No.
Okay.
Centerstone offers those in Columbus, Indiana.
Tell us about that, Kathy. How does that look?
Well, we have our team. We have a lady that's over us. Her name is Nanny, and so she's the one. You just set it up, and you'll have the Zoom with her.
Oh, good.
That type of thing. So it's very in a relaxed atmosphere. You can just schedule it with her, and she'll, you guys link it up, and we have clients that do therapy sessions. We call it, I think it's medical health or something like that. But that's what most of our clients, when they have therapy sessions now, is it's by Zoom. And so we can do that by Zoom also.
Okay, thank you so much.
Thanks for that question. Well, it's 3:25, Melody.
Okay. Well, we have one more session, and we appreciate you and Debbie today. Angela, like I said, we'll get together. We'll probably schedule something for January, February, March.
Sounds great.
Yeah, and if you know people who want to attend virtually, even if you're in Ohio, because we got some people on here from Ohio, they are more than welcome to attend the Choices in Recovery with us virtually. So just email me and say, hey, I want to be on the NAMI Kentucky listserv, and then you'll start to get a lot of information about our trainings and our classes and all that good stuff. Yeah.
I'll make sure our CSU family get that information.
Yeah, that'd be great. Yeah. So so if you want to attend the next session, we're going to have our keynote, Dan Gillison, who is the CEO of NAMI National. So we're really excited to have him, and he's going to be presenting.
Awesome. Hey guys, again, thank you for your time. Thank you for your contributions. We appreciate you guys. Have a wonderful weekend.
Thank you.
Thank you.
Thank you.
Thank you, Angela
Thank
and
you.
Debbie.
Thank you. Nice meeting you all.
Hey, bye-bye.
Bye-bye.
Bye-bye.